Okay. Welcome to Day 3 of Health Equity Week of Action. Today we will be hearing from a student organizer on the topic of Stepping Ahead, a Guide to Organizing Actions on Campus. Jonathan Gomez is a first-year medical student at David Geffen School of Medicine at UCLA. He is also an organizing member of his school's chapter of White Coats for Black Lives. White Coats for Black Lives is a medical student-run organization that was born out of the National White Coat Die-In demonstration that took place on December 10, 2014. Their mission is to eliminate racial bias in the practice of medicine and racism as a threat to the health and well-being of people of color. This past December 10, 2015, White Coats for Black Lives organized a National Day of Action titled Actions Speak Louder. This Friday, our final day of Health Equity Week of Action, we will be continuing the progress of this campaign. Today, we will hear from Jonathan, a student on the ground who organized actions on his own campus at UCLA. So, let's get started. So thank you, Jonathan, for meeting with us and sharing your narrative as an organizer. So today, we're going to have a really informal discussion to learn more about what we students can do on this Friday to have a successful event, speak with our deans, and create action. So can you tell us about how you heard about White Coats for Black Lives and how did you get involved on your own campus organization?
Sure, I could definitely start about that. I just want to start off by saying thank you for having me and thank you so much for doing everything you're doing. It's really important to have solidarity, and I think it's great that AMSA is working towards these same goals. And I think medical students as a whole see that medicine is changing for the better, and we're all really happy to see that happening. So yeah, just thanks for doing this, and I'm very happy to provide assistance with it. So as far as my background getting involved with White Coats, I started out as a first year, and I remember attending the second look at our school and asking, what has been done so far within our chapter at UCLA when I attended second look. And I was approached by a couple of students who sort of told me what had happened, and I think like a lot of other schools, there was a sense that we had this die-in, but we wanted concrete changes to be made, and we felt like we wanted them to be made in a way that reflects what we believe is a public health emergency in our society, and that these things were happening a little bit too slowly for our, we wanted them to happen more quickly. So from there, we began organizing for Actions Speak Louder. Once I became a student, we had our med students for Mizzou Day of Solidarity, which was supported in large part by our Medical Student Council, which was really wonderful. So that was a way for us as students to come together in solidarity with the students at Missouri and connect with other like-minded students who were maybe first years that didn't know, like I did, about the White Coats for Black Lives movement that was happening at our school. So then we started emailing back and forth, and from there started planning for the Actions Speak Louder.
Cool. So it seems like you had some interest before you even began medical school that aligned you with this group. Could you talk about some of the experiences you've had?
Yeah, sure. So I think it's important to talk about identity. I identify as a gay, mixed Latino male. So my dad is Mexican-American, my mom is Greek-American. So I think, coming from a dual immigrant background, it helped me see a lot of the disparities in terms of what kinds of immigrants have privilege over others and things of that nature. So I don't think I've always been interested in social justice, but I think I grew up around very much social justice issues. And so I was really able to see the disparities in front of me in large part growing up. So I think particularly towards the Black community in America and in our society, there's a lot of discrimination there as well. So it's important for me to acknowledge that and to have solidarity. So as I grew older, I became more interested. I worked in San Francisco for a while as an HIV test counselor, where again, you see a lot of disparities regarding race, ethnicity, even within the LGBTQ community, which has a lot of progress that's been made. So I was ready coming into medical school to start bringing up these issues.
Yeah, thank you for sharing your personal narrative and how you connected it to this larger cause. So let's move back into Action Speak Louder. How did you guys go about step-by-step bringing this event to life?
Yeah, so it's definitely a step-by-step process, and I think it's important to acknowledge that we at UCLA had wonderful support from our both faculty and administrators, and that's going to vary by school. So, I think the most important thing is to find an ally. So that's what we did. We found someone. We have a diversity officer at our school, Dr. Taborn, who we approached with our idea and acknowledging that we were organizing a protest, which, different people think about protests in different ways. For some people, it's an inconvenience. For other people, it's a way to have your voice heard. So we approached him as an ally to talk to the administration about what we were doing, and he was very supportive, very much, whatever you guys are going to do, I want to be an advocate for you. So that was really wonderful, and I think a lot of schools have administrators or faculty. You just really have to work for finding someone who can be an ally in that respect, and also tell you what kind of language the faculty want to use. So for us as students, we bring a lot of our community experience. For faculty, they really want to see evidence. They really want to see, they work a lot on improving the reputation of the medical school. So how is this going to make us look better on a national scale? And he helped us with that a little bit. We approached other faculty members and other administrators who were very supportive. We had a meeting with our deans before, so our dean of our medical school and our vice chancellor for medical education. We met with both of them, our vice dean for medical education, and they were also very, supportive and just making sure even logistically, with issues of security and things like that, we were able to connect with the police department at our school and to tell them what we were doing to make sure that there wasn't any issues with accessibility for people with disabilities, which is something you want to make sure to take in consideration when you have a protest. And from there, everything worked out. So, I think it is important definitely to have administrative allies. After that point, we continued meeting within our group to plan our action, and we came up with a petition. So we had a petition ready using data that the LA County Department of Public Health gathers around racial disparities, and particularly in Los Angeles, geographic disparities, and I don't think it's unique to Los Angeles, but areas where people of color live have less positive health outcomes. So in gathering this data, our argument was basically that we consider that LA County is in a public health emergency, and that we feel like the administration needs to respond in a very strong way to this public health emergency that is occurring. So that was the basic outline of our petition. We sent it out to students in different ally organizations like LMSA, Latino Medical Student Association, SNMA, the Student National Medical Association, and our student body in general, to encourage them to sign the petition. And we were able to gain a good amount of signatures and brought that with us to our protest that day. So they could see not only people who maybe couldn't make it to the protest were also in support, and we had a few faculty who also signed the petition. So I think it was a really great show of solidarity and a way to get your voice heard in a way that wasn't, that was in line with us understanding with the faculty that we may share a different point of view from them, or we maybe see things in a different way, but we want to make our voice heard and engage in dialogue, because you don't want to come across like you're not trying to actually engage in dialogue. So I think that's really important.
Okay. So were there any follow-up steps taken after that public protest with the administration?
Yeah, so as follow-up, we have meetings that are going to happen with our vice chancellor for the hospital system. So he's the CEO of the hospital system and vice chancellor of health sciences, I believe is his title. So this is the person who basically runs our entire health system across LA County. So it's a really it's really great to see that we've been able to gain contact with the people who really do make the decisions at our school in terms of what percentage of Medi-Cal patients are accepted at the different clinics, both inpatient and outpatient, what percentage of uninsured patients are accepted, and how charity care is delivered, things like that. So that was really the focus of our day of action, was to increase access for people of color and uninsured patients of low income in our different hospitals and clinics.
Cool. Could you take us through the two main demands of this campaign?
Yeah, sure. So our first demand was to look at the diversity in medical education and in medical schools. And we believe that the diversity of the incoming class should reflect the diversity of our country. And patients should be able to look at whether it's medical students or doctors in their community and say, these doctors look like me, they understand my health needs. And there's been a wide variety of research showing that physicians of color are more likely to go back into their communities. So that was our first demand, was to set the percentage-wise to match the national numbers of Black and Latino physicians. And then our second demand was looking at increasing access for people of color at hospital clinics and at medical school, hospitals, and clinics.
Would you say that your event was a success overall?
I think so, yeah. I think, it's a continuing dialogue, and we're going to see where things go from here. Obviously, change doesn't happen overnight, so we're really happy with how things have gone so far. And I think the administration has been very supportive and encouraging dialogue with us. And I think it's important to know that, as medical students, we do have a really strong voice. You're no longer a pre-med, you're no longer trying to get into this ivory tower. You're part of, at least at our school, and I think at the majority of schools, you're considered a fellow professional. So your voice is really important, because you're going to be an attending in the future. You're going to be that physician running a county clinic or a hospital clinic. So if the decision isn't made now, it's going to be made in the future when we are part of the medical profession, as we already are. So I think it's important to know that, and to know that you have your voice is important. And I think that's been really encouraging in our actions. I definitely will say that I'm very pleasantly surprised by how well things have gone so far.
Do you have any recommendations for our students who will be implementing this plan this Friday when having conversations with their administration?
Yeah, I think it's important to echo again, just finding a faculty or administrative ally, someone who really understands where we're coming from and can provide advice as to what the politics are of the administration and what kinds of ways you could approach them that will be able to start a conversation and not, pushed away. So I think that's very important. And I think also just making sure that you reach out to other student organizations, because there's a lot of allies in medical schools, and it's important to make sure that, it's not just one person doing everything or two people doing everything even, And I think if you approach them before you do, if you do decide you want to plan an advocacy day or a protest, that you let the school know before, because the school, or at least approach an ally and ask them what their advice is, because if the school knows in advance, I think that provides an opportunity to already start dialogue. And when we did that, we found, I think, a lot more students showed up to that protest because they knew that they weren't going to be reprimanded. The dean of our medical school agreed that this was important to her, and that students wouldn't receive any kind of, they wouldn't be reprimanded for attending. So I think that was an important way to both increase the attendance and also start the conversation in a really positive, collegial way. So those are my main points, I think.
Yeah. I think as medical students, we have so many different causes to advocate for. Why do you think racial justice is imperative to tackle right now?
Yeah, I think, we're in a time where racial justice is becoming more and more of a hot topic, so to speak. LGBTQ movement has kind of reached a point of very good progress, and I think now what we're starting to see is that within different movements, people of color racial justice continues to be sort of put at the margins, and I think our society has spoken up against that through the Black Lives Matter movement, and people are now saying that we're no longer waiting. We are now demanding racial justice. So it's important for us to reflect that, because these are our patients, and these are people who really are experiencing pain and suffering, and it's important for us to really, you know, advocate for that and to follow. I think for me, it's in line with our Hippocratic oath, our oath we took at our white coat ceremony in the beginning of medical school. So
your insights have been so illuminating. I'm so glad that you're able to share your narrative with us. Do you have any final thoughts or ideas you'd like to share with medical students?
Yeah, I think one other thing, just a suggestion for logistics, I think it's great to have things convenient for your students. And I think one thing we did, we had when we made our signs, we did it right by where everyone eats lunch. And I think doing things like that, really thinking about making things convenient for people, but also it's a way of calling people to say you can either ignore the issue or it makes it very clear that they're making a choice, you know, because it's easy for medical students to say we're too busy. But when you put things right in front of them, I think it's a very great call to action that I would recommend if you're preparing to not only engage students in these organizations, but your student body as a whole, by putting these events in places where you're going to have a lot of traffic and you're going to have a lot of people going through that area. So that's definitely another piece of advice. But other than that, I don't think so.
All right. Well, we're just going to quickly take our students through this coming Friday's action. You went through the steps really beautifully in your own narrative, but just to quickly go through step by step what students should expect to do to bring this action to life. We'll just reiterate it here, and this guide will also be sent out and posted on our Health Equity Week of Action page. So first, and Jonathan, please feel free to add in any comments or any recommendations as we go through. So step one is build a coalition. So as Jonathan said, you want to bring in students from aligning groups. So students for the National Healthcare Program, AMSA, the Student National Medical Association, the Latino Medical Student Association. So organize with groups who have similar missions. It's imperative to make sure you have people who are on board, who are willing to delegate and be a part of the hard work that needs to be done. Step two is research the claims and facts. So look at your own school's data. What is the racial demographic? You want to look to different pieces of information. So your school's diversity office's mission statement, any health system's mission statement, your school's collaborating medical institution, reports on minority equity or diversity efforts. Look at national data as well. Step three is organize. You want to pre-action prep. Make sure you set up an email or give a phone call to your deans, your diversity officers, and other members of administration who you think are going to lend a ear. So we have some sample text put up on the action guide. Feel free to edit it as you wish. We want to make sure that we stay true to our first demand, which is to enroll an incoming medical school class in fall 2016 that is representative of the American people, with at least 13% Black students, 1% Native American students, and 17% Latino students. Finally, we want you to meet with administration. Make sure you clearly state the goal, give evidence from your research, make it personal. Why does it matter to you as a student and as a future health professional? And then push your dean of administration to come up with a plan of action. Ask them to give a concrete deadline. How long is it going to take for this information? For 1 month, 2 months? Do they need longer? Make sure you come away with a firm commitment about the steps that they're going to take to achieve the goal, and make sure you formalize a plan for follow-up. So follow up, follow up, follow up. You should hear back from your administration about the plan that we made. And as Jonathan said, a petition is awesome. You want to get it, your administrators to sign on, get students to sign on, residents, people from the administration at the hospital, residents, interns, and even submitting an op-ed into your local publication could also be super helpful. And there are a bunch of websites like Kevin MD, they can submit them, or AMSA's New Physician. There are lots of student organizations that are willing and doing this work that you can align with. So that's our step-by-step guide. Do you have any recommendations or any other ideas?
No, I think it's beautifully summarized, and best of luck with everything. I look forward to seeing what happens.
Yeah, thank you so much, Jonathan. You're great, and we wish you luck, and we're so glad that you're going to be a future physician.
Yes,
Thanks for all of your work.
Likewise.
Take care. Bye.
Bye.